All right, let's dive into a topic that you and I see every single day behind the counter: hypovolemia. We're going to break down how you, as a pharmacist, are often the most important and sometimes the only line of defense for your patients.
So, here's our game plan. We'll start with what we're actually talking about. Then, get into the warning signs you can spot. After that, we'll look at the clinical treatment, and then we'll bring it all home to focus on your crucial role in keeping patients safe.
First up, let's define the deficit. And we've got to get our terms straight here. Why? Because in medicine, words matter, and understanding the difference is absolutely fundamental to giving the right advice.
Okay, this slide is so important. We tend to use these terms volume depletion and dehydration interchangeably in everyday conversation, right? But clinically, they are not the same thing. Volume depletion is a salt and water problem. Think of it as losing fluid from the space outside our cells. Dehydration, on the other hand, is mostly just a water problem, and it affects fluid everywhere, inside and outside the cells. So why should you care? Because volume depletion is the one that really leads to those scary drops in blood pressure and the circulatory issues you're trying to prevent.
So now that we know what we're looking for, how do you actually spot this in a patient who's maybe just stopping by for a refill? Let's talk about the clues, the things you should be listening for during those really short but incredibly vital interactions you have at the counter.
You know, when a patient just casually mentions that they're feeling exhausted or dizzy when they stand up, or that they've been dealing with a nasty stomach bug, these aren't just little complaints, they're data points. And when they say this while picking up a prescription for, say, lithium, or they're asking you about laxatives, well, that's when your pharmacist brain should kick into high gear and start connecting the dots.
Now, obviously, you're not going to be taking a patient's vitals at the pharmacy, but knowing this fact is incredibly powerful. When a patient complains about palpitations or their heart racing every time they get up, it's not just a feeling. Their body could literally be screaming for more volume. This one clinical sign gives you so much context for just how serious their situation might be.
So here are a few other signs, but that clinical note at the bottom, that is a huge pearl for us as pharmacists. Seriously, think about it. You glance at a patient's profile, you see they're on metoprolol, and they tell you they're feeling dizzy, but they don't mention a racing heart. Well, that beta blocker could be masking one of the key warning signs of hypovolemia. That's a connection that, honestly, you are in the perfect position to make.
All right, to really understand why your advice is so critical, let's take a quick look at the clinical playbook for treatment. Because when you see what happens when things go wrong, it really highlights the value of getting things right from the very beginning.
This is the crucial point right here. The treatment isn't just about making the patient feel less thirsty or dizzy. It's about preventing a dangerous cascade of events that can lead to ischemic injury. That's when vital organs, like the kidneys, just don't get enough blood flow, and that can spiral into multi-organ system failure. I mean, that's what's really at stake here.
This slide lays it out perfectly. You've got two paths. On the left, that's the path you want to keep your patients on. It's manageable with simple oral fluids, things like salted broth or juice. But the path on the right, that's the one that leads straight to the emergency room, the one that requires IV fluids, because the deficit is just too big to fix at home. Your counseling is the guardrail that keeps them on the left path. And when a patient unfortunately ends up on that right-hand path, this is what happens. They're getting IV crystalloid solutions, like normal saline. These are the absolute workhorses for rapidly filling up that empty tank. They work, they're everywhere, and they're way more cost-effective than things like albumin. Just look at the urgency here. A full liter of fluid in 30 minutes. Then another liter over the next hour. This isn't a casual drip. This is an aggressive resuscitation designed to prevent organ damage. And it's exactly the scenario that your counseling can help patients avoid altogether.
Okay, let's get to the most important part of this whole conversation. Let's see how all of this builds up to your role, because this is where your expertise directly translates into better, safer outcomes for your patients.
So let's just ask the question directly. You've got a patient with a nasty stomach flu. They feel awful, they can't keep anything down, they're losing fluids. In that moment, what is your specific, actionable role to prevent this from turning into a trip to the ER?
And here it is. This is the answer. It's so simple, it's elegant, and it is unbelievably powerful. Sick day management. This proactive conversation is your superpower. It's all about knowing which medications, perfectly safe on a normal day, can become downright dangerous when a patient is volume depleted.
This is the hit list, right? We all know these drugs like the back of our hand. But the key is to explicitly tell patients, hey, if you get really sick, if you have vomiting or diarrhea and you can't keep fluids down, you need to temporarily stop taking these. They're all hard on the kidneys, and their toxicity just gets amplified when the kidneys are already under stress from low blood flow.
That's it. That one single piece of advice delivered in a conversation that might take all of 60 seconds is honestly one of the highest impact interventions you can make all day. You are directly protecting kidney function, you are preventing acute kidney injury, and you are literally keeping your patient out of the hospital.
So here's the bottom line. Every single prescription you fill for one of these drugs is an opportunity. It's a chance to educate, to empower, and to prevent a crisis before it even starts. The only question left is, what are you going to ask your next patient?